Welcome in, everybody, to Speducated. It only took a few hours before the professional degree story started hitting all the mainstream networks. We're going to go ahead and watch some of these clips. I'm really thankful that they're actually doing this.
So I got a question for you. What is a professional degree? The U.S. Department of Education has a new definition about this. By its new standard, professional degrees include those in medicine, dentistry, and law. But programs for audiologists, physician assistants, and nurses are not considered professional. Charlie Wojciechowski explains what this means for students.
Is nursing a profession? New policies from the Trump administration's Department of Education say it isn't. And now, no longer qualifies for the same levels of student aid nursing students have received in the past.
I want to remind everybody that what came out of that rise and education department meetings that they've been having are it's nothing set in stone yet, and that's not me advocating that things are going to change, and it's not me advocating that things are going to stay the same. So this is what the current news is. This is what they're saying, and thankfully some of these new news outlets are actually digging more into it because they're getting some feedback from the administration, which allows us a little bit more of a window into how they're thinking about things. So
Mona Finnegan is the dean of the Loyola University School of Nursing.
To be honest with you, I'm absolutely appalled. This really, now with the demand for nursing outpacing the supply, this is really going to cause people who are thinking about entering the profession to reconsider.
For hundreds of thousands of students studying nursing, the funding cuts will be significant, according to the dean of nursing at UIC.
Now, student loans are being tied to that definition of a profession. Yep. So, for example, if you're in medical school or in dental school or in pharmacy school, you can borrow up to $50,000 a year for your education. If you're in nursing school, you can only borrow up to $20,500 for an education.
See, that's really strangling the nursing sector. It's something we're desperate for, right? Like I was saying yesterday in a video related to this, Canada is just opening the doors for our nurses and for our doctors. And I just saw a news story from Canada when they were inviting all these nurses in, and they were basically giving them the red carpet treatment. So what I don't understand is that if they're such a vital component to our society, being first responders, why is it now they're being treated so terribly, or at least in their statements and in the way they're framing their conversation in these meetings that they're having? So it's crying shame.
And many of our more advanced degrees cost significantly more than that.
The American Nursing Association says the new policies will hurt its members and reduce the number of nurses in the future.
Capping nursing education at $100,000 isn't going to work. So why we cannot have the same amounts as physicians is just unfathomable.
The department,
she said something that's like, it's not going to work, but I wish she would get more into that. Like, work about what? She seems to have at least a thought about what they're trying to do. And the only thing I can come to reason with is that they're trying to cut the field, because nobody's going to go into that field if they can't pay for it, and if it's not going to produce the kind of revenue in a career that they need. So I don't know.
Education did not respond to our request for a comment, but in the past told Newsweek that we're not surprised that some institutions are crying wolf over regulations that never existed, because their unlimited tuition ride on the taxpayer dime is over. The education,
the same kind of negative talk we get out of the administration about everything that actually matters in our society, and now it's like, here it is in education, right? But the thing is, it's been happening for months, right? There's been this underlying current of this kind of negativity about education as a whole. So here we are seeing it come out now in our jobs, right? For careers. So like I said, education, bedrock of society. Without it, it all falls apart. And here they are attacking it.
New rules aren't set in stone, and there is hope they can be changed before they go into effect next year.
Yeah, I got another one for you. Let's skip to another one.
Graduate nursing programs are no longer considered a professional degree by the U.S. Department of Education.
This change comes after the implementation of President Trump's federal spending bill called the Big Beautiful Bill to cut back on spending. Well, Madison Porter has talked with a Kentucky nurse who is upset about.
My understanding is they tried it with the Big Beautiful Bill. They tried this exact thing, and then it got just ripped apart when people found out what was going on. So after that, they had to take it out, and then now they're trying it from a different angle.
Change.
It's Joy Cole's dream to expand her doctoral degree in nursing and focus on family practice in rural Kentucky. She was able to complete her initial graduate training at University of Kentucky with the help of federal loans. However, she's concerned the reclassification of a nursing degree will affect her plans.
How does one afford to go back and pay for an advanced degree without funding?
The U.S. Department of Education no longer lists nursing as a professional degree. Without that title, federal loans will not be available for graduate students, not only affecting Coles and her family, but future nurses as well.
Without nurses having the ability to expand their training as professionals to provide care for patients, we fear that the deep canyon that already exists will only widen.
Think about anybody that you've known that's been in a hospital for a long stay, right? You know, the doctor comes in, they're doing their rotations, they come in, kind of give you their spew, check you out a little bit, put the stethoscope to your chest, make sure everything's good, then they're out of there. But who is it you see all the time coming through? Right now, my mother's in the hospital, and we can't say enough about the nurses, right? Because they're the people on the ground day in and day out. They're the ones you see most often. They're the one answering the questions. They're the ones that are helping. And look where we're at. Crying shame.
Kentucky is currently in a nursing
ridiculous.
shortage, according to the state's hospital association. Coles says 107 counties in Kentucky are considered health professional shortage areas, but she says patients are the ones to face the consequences.
Without nurses to provide care to patients, you inherently affect patients' health.
Nurses receive additional education to obtain a bachelor's and master's degree and doctorates in nursing. Coles says it's important to have that higher education of training in order to provide quality care to patients.
When you access care in the hospital, you want to feel confident that that professional caring for your wounds is a professional, that they've been educated. Without that, where will our healthcare system be?
In Lexington, Madison Porter.
Well stated. Look, I'm going to keep an eye on this. I'm going to keep pumping it out. You keep pumping it out. You keep spreading the word, because we got to make sure we're keeping an eye on this kind of stuff. This is critical time, man. So, you know, it's appalling, to say the least. All right. Give me a like at the bottom if you like what I'm doing here. Just keep spreading the word. Let's keep getting this out there.